I wish the president asked those of us in the business because we all know how complicated it is. I think it will have several effects on our patients. One is with the capping of Medicaid and the amount of Medicaid funding that comes from the federal government to the states that will predictably limit the number of people who will receive Medicaid or receive Medicaid funding, or will definitely change the reimbursement structure of our Medicaid funds. That's huge because that takes care of Medicaid takes care of the most vulnerable people in our community, pregnant women and children and the disabled. We probably will do our best to not cut back on services, but we will have to seek more philanthropic dollars in our community. We will have to look at raising our prices, meaning our people who will have to pay more for their fees when they come here, which will be a struggle for folks.
My main concern is this is work for professionals. It is work for the families and their children. This is not work for politicians, and they're not listening to us. The burden of regulatory compliance that is being placed on physicians that do primary care is really driving people away from practicing medicine.